Hi, I'm Dr. Marianne Goodman. I'm a professor of psychiatry at the Icahn School of Medicine at Mount Sinai. I am a researcher in suicide prevention. I do a lot of work in clinical trials and high-risk behaviors. So suicide is the 12th leading cause of death. There are about 130 suicide deaths every day, and that's one about every 11 minutes. In 2020, there were almost 46,000 Americans who died by suicide, and this is twice as many than homicides. In fact, there were also 1.2 million suicide attempts. This turns out that white males are about 70% of the suicide deaths, and firearms are used in over half of them, and I'll be talking more about that as the program continues. If you ask about who are the highest risk individuals who are dying by suicide, it turns out it's individuals in the age range of 75 to 85, and the second highest are those in our younger cohort of 25 to 35. Unfortunately, in the past 20 years, the age-adjusted rate of suicide death has increased 30%, and this is a national crisis with a lot of efforts, research, and clinical programming developed to target this elevating rate of suicide. So, who's at most risk? Those that are, I mentioned previously, different age cohorts are most at risk, but anybody is at risk for suicide. Those who've had a previous suicide attempt, those with depression, anxiety disorders, people suffering with chronic pain, people who've had a recent job loss or financial problems, substance abuse, victimization, trauma, relationship issues. So you can see there's a wide variety of risks. Now, it's interesting, there's not an equal risk at all times. It turns out that certain days of the week have higher rates of suicide, and that's Mondays. In fact, weekends have a lower rate. Months of the year, so the springtime and summertime, where the months are longer, the risk is higher, and actually in the middle of the night between 2 and 3 a.m. So, and then also geographically, those in more mountainous states are at higher risk than those on the East Coast, and that may have something to do with firearm access. Again, I'll be talking about that in more detail. So there are several common causes of suicide and suicide thinking. I mentioned some of those before as risk factors, but if people who have mental health concerns, I mentioned depression and anxiety, feelings of failure, being stigmatized, bullied, long-term illness, people who have isolation and loneliness, these are tremendous causes. And but I do want to also mention there are some protective factors that actually lower the risk of suicide, and those include helping people with establishing coping abilities, having a purpose and reason for living, strong cultural identity, connection to others, and diminishing access to lethal means. So if we can target these things and increase our protective factors, it actually mitigates some of the risk. So there is tremendous growing concerns about suicide in our younger people. Suicide is now the second leading cause of death among people aged 15 to 24. And it's interesting, the highest rate of suicide death in youth are American Indians and Alaska Natives, 23 per 100,000. Now, whites are second, about 6 per 100,000. African Americans are at 4 per 100,000. But in spite of those numbers, there's a lot of recent evidence that suggests this problem is growing in this age cohort. So if a recent study that looked at just the past year, high school students, found that 20% of high school students had reported serious thoughts of suicide, and 9% made an attempt. Now that is just astronomical numbers, 9% of high school students. Now, it's not just high school students. There are reports about pre-adolescents, so children 10 to 12 years of age. They have reporting in emergency rooms, increased in suicidal ingestion of substances. That's up 4.5-fold in the past 2 decades. And also other reports of the use of firearms in youth is the highest in the past 20 years. Now, I'm going to talk more about the pandemic coming up. There was an increase in firearms suicide death, about 2% in adults, but 15% in young people using firearms during the pandemic. So clearly the stressors are impacting youth, and it's coming out in suicidal expression. So the pandemic, interestingly enough, suicide rates actually diminished 3% in 2020. They actually peaked in 2018, so this was the continuation of a cycle going down. Now, why is that? It could be that people pull together during a crisis. Some of the stressors that were lessened during the pandemic, as children were home. Well, some people could argue that children being home was a larger stressor, but there was also an increased attention to mental health. So while the pandemic was stressful, some of those forces were mitigated with the suicide rate coming down in 2020. So the 988 National Hotline started in January 16th of this past year. And this hotline will now connect people to the National Suicide Prevention Lifeline. And that lifeline then connects to various resources, including the Veteran Crisis Line, the U.S. Department of Health and Human Services, and the Federal Communications Commission. The Biden administration invested a tremendous amount of money into this infrastructure. It went from $24 million to $432 million. That's an 18-fold increase. And this really was to kind of address mental health crises and the suicide numbers that had been increasing. And this call center will now allow a network of more than 200 state and local call centers. The year before 988 came in, there were about 3 million calls, chats, and texts to the Lifeline, and that's expected to double within the first year of having 988. So the implications are there is now a tremendous infrastructure for crisis calls and to capture people at their most vulnerable moment. Signs that somebody may be in need of help. This is a really, really important issue. Suicide prevention is everybody's responsibility. So things that you would want to look for are an individual who is sort of talking about suicide or talking about death, describe feeling trapped or a burden to others, this notion that people would be better off without them. So you could look for reckless behavior, driving at high speeds, mood swings that go up and down. Sometimes these individuals will socially isolate, turn off their phones, not respond to texts, not answer the door if somebody comes by, often express hopelessness, helplessness, maybe sleeping too much or sleeping too little, and you might see enhanced use of alcohol. If you are concerned about a loved one or a friend, it's really important to reach out to that person, talk to them, listen really carefully. Don't pass judgment about what they're saying, but just really encourage them to tell you what's going on. Reach out to them and ask some difficult questions about do they have a plan? Are they feeling so bad that they think about ending their life? And just be there to hear what they have to say. It's important to empathize with the pain that they're going through, help them to connect to either friends or supports, potentially if they're really in crisis, emergency services, the 988 line, professional help. It's very important to convey to these individuals, to reassure the person that that they won't feel this bad forever, and that negative feelings do get better over time. So really just that you're there, express hope and concern. There are tremendous resources available, all about suicide prevention. As we talked about before, the 988 line is a 3-digit number that you can call 24/7. Those individuals will talk and help whoever calls. There are other resources, lots of different organizations that are involved in suicide prevention, including my favorite, which is the American Foundation for Suicide Prevention. They have a wonderful website with all kinds of information, resources, and facts. Really lovely website. There's another website, Means Matter, which talks about the importance of restricting access to a means to kill oneself. It does turn out that methods really matter. There's an 80 to 90% fatality when you use firearms, and really 1 to 2% by pretty much everything else. So if we can limit access to firearms, especially for those who are vulnerable, we can really make a dent in suicide prevention. And so the Means Matter website really gives information all about that. I spoke really just in the last question about methods matter, and I think that's really that I would like people to know. If we're very serious about addressing suicide and bringing those astronomical numbers down, we do really need to take seriously the limiting of access to means. Firearms, as I mentioned, over 50% of people die by suicide use firearms. If we can limit access to people when they're vulnerable, have them safely stored, have families involved, we can actually make a difference. It's just the pulling of a trigger, which can happen so quickly with firearms, that sort of urge, the impulse, and then you can't take that back. Whereas other methods, there's more of a chance, there's more time, there's involved. So I think if we can kind of join efforts in helping people identify suicide risk, limiting access to ways that they could kill themselves, and using these crisis services that are now really in much more abundance and available, that 988 number, I think we can make a big difference.